lacrimal apparatuses here. So, the lacrimal gland. So that's going to produce tears, and that's going to be positioned superior-lateral here. So this is the lateral side of the eye. This is the medial side of the eye. The tears are going to drain and wash across the cornea, which is this outer portion that's going to refract the light as it enters the chamber of the eye and ultimately hits the retina. But when those tears drain, they're going to travel through the lacrimal punctum, which you can't see here, but you can see the lacrimal caruncle, which is going to produce the whitish oily secretion that will eventually become sleepies or eye boogers. The tears, after draining through the lacrimal punctum, will travel through the
Lacrimal caniculi.
lacrimal canaliculi, and then it will drain into the lacrimal sac, and then into the
Nasal lacrimal duct.
nasolacrimal duct. All right. You've had some studying going on. Good idea. Okay, for the palpebrae, so this is the upper palpebra, the upper eyelid, the lower palpebra. Where the two palpebrae meet laterally is the lateral, that was awkward, lateral canthus. This is the medial canthus. I think that's it. So, I don't think I've ever tagged this, but I just recently discovered that it's on here. So this is gonna be the palpebral, the mucous membrane that, if it gets inflamed, produces pink eye. That's the palpebral conjunctiva. I don't think I'm gonna tag it this time, but maybe another time. So here we can see the extrinsic eye muscles that are going to be attached to the sclera, this outer fibrous portion of the eye. This is going to be the superior rectus. It's going to be straight. This is the lateral rectus, also straight. This is the medial rectus. And then this is the inferior rectus. Where can we see it? Right here. This is the inferior oblique, running at an oblique angle. Here. Inferior rectus. And then this is going to be the tendon for the superior oblique muscle. We are now at the level of the middle layer, which is the vascular layer, and that's when we contain the vasculature, which is the choroid. Here we can see the iris, so that's going to be based on the pigmentation here, the concentration of melanin, the lack of melanin, other pigments that we'll find in the area, that will dictate what your eye color is. Here's the iris. Well, that's the iris. This is the pupil. That's the opening. That's going to increase and decrease in size based on the activity of the ciliary muscles here. That will consist of smooth muscle that will be involuntary and dilate the pupil or contract the pupil. This area is meant to denote where the vitreous humor is going to be, that more gel-like fluid that we'll find in the posterior chamber here, or posterior segment. In the anterior segment, there's going to be a different type of fluid, and that's going to be the aqueous humor. And that is going to drain via a structure we can't see here, but that's the scleral venous sinus. And that's going to, if it's compromised, increase the intraocular pressure in this anterior segment and lead to a pathology. What is that pathology?
Glaucoma.
Glaucoma. It's also language. Here's the lens. And on the posterior aspect of the eye, we can see the optic disc. And that's going to be where all the axons from the ganglion cells in the retina are going to exit and form the optic nerve. We don't see it on this model, but adjacent to the optic disc is going to be where we're going to find an area / areas that have high concentrations of cones. What are those? The fovea. So the fovea has exclusively cones, and the macula lutea has a lot of cones, but not exclusively cones. So it has a high concentration of cones.
What was the name of the exclusive cones? Phobia. And then the high concentration of cones. The maculae lutea.
Eyelids, the pupillary.
How do you spell the last part of that word? Lutea. Mm-hmm.